Hello, my name is Nelin Krull, and I'm the co-owner of Myofascial Mississauga. And I'm really excited to be here today to drop some bombs on the Bombshell 1111 podcast with Kia.
Welcome back, you guys, to Bombshell 1111 podcast, where we bring the boom to your mental health and personal development. Tune in as we dive into an impactful conversation tonight, you guys, and drop some mind blowing tips to help you level up in your life. We'll be diving into a powerful conversation, unlocking self healing, myofascial release for chronic pain and emotional wellness with Nelin. So, without further ado, bombshells, let's get into it. Welcome, 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 Nelin. How are you?
I'm doing well, thanks. Thank you so much for having me.
Thank you so much for coming on and being a part of the podcast. I'm so excited to have you here. One, I got your name correct.
Yes.
Whoop to the woo woo. Okay. And also I got the word correct with your profession. And so I think I'm winning for tonight.
Yeah.
So again, thank you for coming on and being a part of the podcast. Down below in the description, I will have your bio for the listening audience to learn more about you and what you do. But I generally start off with allowing you guys to just verbally give us a short description about who you are, what you do, and where you're from.
Of course, yes. So my name is Nelin, and I'm a registered physical therapist. So we call in Canada, we're physiotherapists or physical therapists. I think you guys tend to use the term physical therapist, but that's what I do. I've been doing it for about 13 years now, and I'm in business with my husband and partner in life. He's also a physical therapist. And we started our own practice back in January of 2020. So it was super good timing. And we decided to open a practice that sort of filled a gap where we are, which is a gap where a lot of people suffer with chronic pain. There's not a lot of great treatments out there, but we managed to find one that seems to work really well. And so we decided to build an entire practice out of it. So we've been doing that for the last 5 years, and it's been going well. We love it. And so now our mission is just kind of not to just be able to reach the people in our sort of local geographic area, but also to share how people can find healing wherever they are, even if they're not close to where we are.
So you kind of went right into my next question, because I was going to ask about your journey and your background. Other than being able to have, of course, that flexibility of being independent and being your own, being an entrepreneur, what initially drew you to physical therapy? And how did those experiences in the hospital setting shape you to approach this patient care?
Yeah, of course. It's actually kind of a funny story. It started when I was 12. I was doing career day at school, and we each got randomly assigned a career to explore, and then we had to sort of like present it at the end of the day. And so I got assigned physical therapist, and so I learned all about it in that one day, and I was like, this is it. This is what I want to do. I'm going to do this. So that's just what I started working towards from that moment on, from high school to university, and then my master's degree. So I became a physical therapist, but interestingly, when I graduated, most of my classmates were going out into the private sector. So they were all, like treating like sports injuries and things like that. But I was really, really fascinated by the world of physical therapy in the hospital setting. And so I was treating patients I was at the hospital for about 6 years, my local hospital, and I was working with post-surgical patients. So seeing them post-op, helping them with respect to rehabilitation of, mobility, but also had a special interest in working with respiratory patients or patients who'd gone some sort of like thoracic or lung surgery. And so I did that for 6 years, and then I had my first kid. And then after that, it was really, really challenging to maintain sort of the demands of working an intense hospital job like that. I was actually, when I went back to work after my maternity leave, I was working in the emergency department. And so I was doing like 12-hour shifts, like day in, day out. The burnout was really intense. And I just decided I couldn't do it anymore. And it just so happened sort of around the same time, my husband, who's also a physical therapist, he was getting pretty disenfranchised with working for other people. He just really wanted to be the one in control of how patient care was going on, because I think it happens kind of everywhere, not just where we are, but likely where you are and most of your listeners are. There's a lot of private physical therapy or physiotherapy clinics out there who treat you more like a number than a person, and we didn't want to work for those people anymore. He definitely didn't, and I was done with the burnout. So we just decided to sort of jump in on this project together at the end of 2019. So we opened our practice in January of 2020. And because I had more of a hospital background rather than a private background, I actually set aside my clinical patient care, and he sort of took over that piece. We hired on some staff, and I became the clinical director, owner, wearing 17 million different hats, being the head of HR, the head of accounting, the head of everything.
Head of everything. Yeah. Yeah.
So that's kind of how we got to where we are now. So.
Oh, congratulations on that. Yeah. That's really dope. Can you share more about your passion for women's health and how it influences the work that you do for myofascial release?
Yes, absolutely. So the thing about chronic pain is that it actually affects women more than men. So if we're going to be dropping truth bombs here, there's number one. The majority of chronic pain sufferers are women, and 1 in 5 people are diagnosed with some sort of chronic pain condition. So it's the numbers as they're being tracked anyway are going up, which means, and if the majority are women, that means more and more and more women are suffering with chronic pain. Mm-hmm. And as someone who is a woman and has had 2 children, it's for me, it's painfully clear why. There's a lot of literature to show that chronic pain is often sort of the end result of previous trauma. And just being a woman living in the world that we live in, we undergo a lot of trauma. We really do.
Yeah.
And even if sometimes it's good trauma, right? Like just giving birth, that is a trauma to your body. It's a huge shift in your mindset, and it's something that you're kind of reeling from for years afterwards, right? And it creates these physical shifts in the body that manifest often as pain. We see a lot of women who don't sort of put 2 and 2 together. They start coming to see us in their 30s or 40s. They've had their kids and everything was fine in the first few years, and then the stress of life builds up. And then they're like, wow, everything just hurts now. And it's because we haven't sort of processed all the trauma that the body's been through and you've been through mentally, even though it was good trauma, right? And then on top of that, women tend to be the victims of all kinds of other, traumatic experiences as well. So it just showed me how in a world where physical therapy tends to be kind of male dominated, that there needed to be a safe place for women to be able to go and be heard and understood, and not have someone downplay their symptoms, and have a team that really understands what they're going through, as opposed to sort of shuffling it aside. So just for me as a woman, that's kind of where it came from.
It's so crazy that you're saying the things that you're saying, because it seems like deja vu, because I am too a woman, and I too deal with the fibromyalgia.
Yeah.
So my friend, one of my closest friends, she also deals with it. I have relatives, my mom.
Yeah.
And it literally came on after I had my second daughter. In both C-sections, and they both were very intense labors, and so like you said, and that was in my 30s when I started to figure oh my God, I'm hurting. Trying everything, a chiropractor, acupuncture,
Yeah.
Anything you can think of to
Yeah.
possibly help get rid of that pain, you're
Yeah.
doing that. So yeah, the things that you're saying, I'm like, oh my God, I've heard this before. Like yeah,
You've lived it. Yeah.
I
Yeah.
lived it. I lived it.
Mm-hmm.
So, but for those who are unfamiliar with myofascial release, how would you explain it, and what are the benefits for someone managing both physical pain and emotional trauma?
Yeah. So in order for me to explain it, I'm going to give you a really quick and dirty as I can of explanation of what the fascia is of the body, because your body is made of fascia. It is the connective tissue that connects every single cell in the body. So a lot of people think of it, or if they have some knowledge of it, they think of it more like a sausage casing, or just like the sheath around your muscles. But it's actually the scaffolding for every single cell. So not just muscle tissue, but bone, your nervous system, your blood vessels, your brain, your internal organs, everything. And so oftentimes when we see people who have chronic pain and they have restrictions in their fascia, it doesn't just happen in the muscle or in the joints or in the bones. It can also, restrictions can manifest in your internal organs. They can manifest in your brain. And so it can bring on symptoms like chronic migraines, or, if it's in your digestive system, like IBS. And so we often see, we often see people who have, like unexplained pain, or they'll come in with a diagnosis of fibromyalgia or possibly myofascial pain syndrome, because their pain doesn't really fit like a proper clinical pattern, right? It's not like a knee injury. It's not like it's not like just one muscle that's creating problem. The pain is kind of all over the place and in places that maybe doesn't necessarily make sense. But if you're looking at the body from the perspective of your fascia, where everything is connected, if you have restriction in the fascia that supports the surrounding blood vessels and nervous system and the internal organs around it and the muscles that are controlling all that area of your body, then it makes sense that you would see symptoms related to all of those things, not just the muscles or the joints. And so how myofascial release works is we release the restrictions in the fascia. So whenever we get a restriction in the fascia, it's sort of the best analogy I can give you is like bubble gum in hair. So your fascia is the hair. So that's your connective tissue. It's a web of connective tissue, and it lives in fluid. It lives in the fluid that surrounds all of our cells. And when we experience trauma, whether that's physical or emotional, our body reacts by thickening that fluid and really just like adhering down, all those fibers of connective tissue. And so now what used to glide freely is now stuck down like that bubble gum in hair. Exactly. And so, because this happens in such a sort of like a microscopic environment, you don't necessarily recognize it right away until it gets pretty bad, usually, right? Like you get really symptomatic. But that tension, that stuckness, that's going to create patterns of strain in all the structures there. So not just the muscles, but also the bones, also the nervous system, also the blood vessels. So you're going to see, decrease in nerve conduction. You're going to see decrease in blood flow. You're going to see, like this environment where none of the cells are really able to communicate because they're all just kind of stuck. And so in order to reverse that, what's required is low load, prolonged pressure or stretch. So what that means is, instead of just like getting your elbow into an area of pain and just like digging in there, what we do is we find areas of restriction. We apply gentle pressure, just meet the tissue where it's at, and hold that pressure for a minimum of 5 to 10 minutes. So it's not like a quick back and forth. 5 to 10 minutes, when you're the patient, it actually does feel really long. And that time component and that gentle pressure allows for that fluid, that sticky fluid that I refer to as the bubble gum, allows it to sort of melt, become less sticky, become less like bubble gum, and more like back to watery, what it should be. And so now all of our, fascial fibers can move and glide the way they should. The cell communication is restored, and people feel a lot better. And it's that sort of time component and that gentleness that a lot of conventional therapies out there tend to be missing out on. And so that's what we offer to our clients. And the beauty of it is that it is something that we can do for people, but it's also something that can be taught. So you can do it for yourself as well.
Wow.
Mm-hmm.
Okay, you are like literally reading my life.
Oh boy. Okay, that's not a good thing.
I have fibromyalgia. I have IBS. Oh my gosh. I'm like, oh my God, like she can fix me maybe.
I can definitely teach you and help give you the tools to help you do it. You can do it for yourself, like, because we don't live in the same country even.
Yeah.
But
Okay.
yes.
That would be so beneficial. I think that's so beneficial because especially here in the United States, and it's seemingly growing, women being diagnosed with fibromyalgia specifically. And as you stated, in the early 30s, going up in age. So I think that information, the things that you're doing in reference to this particular, I would say diagnoses, I think this is really, really good information. What tools or techniques do you recommend for anyone that's on their journey to like self-heal and maintain their physical and emotional well-being?
Yeah, of course. I mean, there's lots of tools I can recommend. The easiest piece of advice I could give anybody is to sort of just let go of the ideas of everything having to sort of like fit into a pattern or a box or make perfect sense. One of the best things you can do for yourself is sort of learn what we teach our patients as a body scan. So basically it's a bit like a meditation. Close your eyes, you focus your attention inwards and just feel what you feel. So it might not make sense, like the pain where you feel it might not make sense to you logically, but your body understands it and knows it's there for whatever reason, and it needs attention, right? So those things, if we can let go of those ideas, that's the best thing you can do to start that sort of healing journey. And then using a tool like a myofascial ball or a really soft density foam roller. Those are a couple of my favorite tools to create that low load, prolonged pressure or stretch. So essentially you take this ball, it's an air-filled rubber ball. It's about 4 inches diameter. And it's air-filled so that it has a little bit of squish. So it provides that sort of gentle pressure. Put it anywhere on your body where you feel pain, and then you just lay on it. Put it between you and the floor and lay on it for that minimum of 5 to 10 minutes and let your body sink into it. And you will feel that sort of melting sensation underneath the ball where that tissue has become really stuck. And you can do it anywhere. You can do it on your C-section scar. I do that all the time. You can do it in your gut. You're not really necessarily working on any muscle group, past the abs and in your gut, but there's likely, especially with IBS, there's often restrictions in the fascia connective tissue sort of structure of the intestines and the stomach. But also just any stretch you're going to do, if you find it to be helpful, just ease off a little, don't force into it so hard, and also make sure you spend more than just that 30 seconds that most practitioners or professionals will recommend. Stick with it for that 5 minutes. So that means you need to find a good, comfortable position to be in to stay in there for 5 minutes, because nobody can do like this for 5 or 10 minutes. You know what I mean? That is impossible.
No.
Yeah. So we do that in person in clinic with our hands on patients, but we send them home with our visuals and diagrams and illustrations of how to use a ball or a foam roller or nothing at all. Just them and their floor or their yoga mat, whatever it is, and get into a position that's comfortable, that provides that gentle stretch, and that they can stay in for that 5 to 10 minutes.
So, Nelin, what are some common misconceptions about chronic pain, and how does your clinic specifically deal with those challenges differently?
Yeah, I would say that the biggest misconception that people have, especially with chronic pain, is that it's all in your head. It's almost never just in your head. I think that's a lot of personally, I think it's a lot of gaslighting. There's another truth bomb for you. But, like the issue is that we've been taught to compartmentalize so much in our lives, not just physically, but mentally. So it just like you, when you're kind of like putting these pieces together as I'm giving you this information, other people will be doing the same. They think about, oh, wait, I did have, a surgery back in whatever, or I was in a car accident. I ended up being fine, but I still feel anxious every time I drive, or those things, those traumas that we carry with us. We don't always put two and two together to say like, oh, that's interesting. After, maybe a loved one passed, I started getting these symptoms and I wouldn't have thought to put the two together. And so people compartmentalize, right? Like if they have pain, they go, to a physical therapist or whatever, and they try to work on that one area of pain. But that simultaneously now they're also going to maybe a psychotherapist or a counselor to do some talk therapy to get the two sides of the equation. But truly they coexist, right? You can't separate the physical pain from the trauma that caused it. Really, your body can't. We store that in our bodies. And so it doesn't matter how much you try to talk it out. If you don't connect with it, instead of waving it off as just something like, oh, that's for psychotherapy. Those things coexist in your body. And so finding a mindful treatment that addresses not just the physical pain, but allows you to process the emotions and the feelings that come up when you address the physical pain, that's key. That's where the real magic happens. That's where the healing happens. So compartmentalizing or just assuming it's all in your head is got to be the worst mistake someone can make when it comes to dealing with pain.
Yeah, I totally agree, because when I first prior to me getting diagnosed with the fibromyalgia, I'm going to the doctor. I'm Miss Google USA trying to figure out, what does this pain mean? What does this mean? Blah, blah, blah. Going to the doctor. The doctor is like making me think I'm crazy. I'm not crazy. Yeah. I may look like this, but I'm telling you, I'm hurting. Like I'm hurt. I'm in pain. I'm telling you, like my hands are going numb. I'm telling you that this is really, I'm feeling these prickly feelings, like these sensations, like, finally, ironically, I went home to visit back home in my home state, and my cousin was dealing with the exact same thing, and she had her diagnoses, and it was just so similar. Yeah. So she told me, like, go see a neurologist. I go see a neurologist. He diagnosed me right away, excuse me, with the fibromyalgia, and that was in 2011. And, going through all those different cycles, as I told you before, acupuncture, chiropractor, physical therapy, all those different types of things, but having to also change my routine, going to bed at a certain time, only being able to eat certain foods because I know these foods will upset my stomach or blah, blah, blah. So that totally agree when you started the top of the conversation saying that people saying that it's in your head. So
you feel what you feel, and nobody else lives in your body, and so you have to honor that, right? Like only you will know when something is gonna really help you, right? And it usually is a more mindful path because, like I said, your body and your brain are connected. You really cannot separate them.
Yes. So Nelin, what is the vision for Myofascial Canada, and how do you see your work evolving to the future, empowering patients, particularly women?
Yeah. Oh, I love this question because it's a really exciting thing for me to talk about. And really, our vision for our practice is to be the go-to chronic pain center in all of Canada. You guys in the States are lucky enough to have a few really good ones where you are. There's none up here.
Oh, wow.
Yeah. This technique of myofascial release, it's taught by a group out of the United States. And so there's actually very few practitioners up here with with this training. And so having seen what it can do for people firsthand, we would love for people all across Canada, and even ones who live closer to us in the States than they do to their closest center, to be able to come and get the treatment that they've been waiting for. Like you said, the thing that finally works for them, and empowering them to not have to rely on us for the rest of their lives, essentially, to be able to feel good. We want them to learn how to connect with their own body. We want them to learn these techniques so that they can pull them out whenever they need them, like a toolbox. So that's really our vision. Our goal right now is to educate people as much as possible about how they can achieve this for themselves. We've created an online course to be able to expand that reach. And we also have a program that allows people to come fly into where we are, get a week of intensive treatment, which is about 3 or 4 hours of treatment a day for 5 days straight. And they basically leave a new person. And we want to make sure that people understand all across Canada that, and in other parts of the world, that if they are in need, that we are here for them, and that they don't have to, spend all their days and nights on Google and searching for the solution when we're right here.
Oh, wow. That is so dope. I wish you the best on your future endeavors. I know you guys are going to be successful, because this is such needed thing. And I know we've been talking particularly specifically about women, but now in the United States too, it's becoming more common for men to experience the chronic pain. Especially those men who work in like the more, I'll say, stressful environments, healthcare, certain parts of healthcare, and then of course those men that work in general labor, like actual labor. Actual labor. Yes. I'm sorry. So I've also noticed that too. And then, it's so crazy that a lot of people here, they're just now becoming more knowledgeable of fibromyalgia and the chronic pain thing, as you stated. So I think it's a much needed service. And so again, I wish you the best in your future endeavor.
Thank you. Yeah, we're happy to help anybody, men, women, children. We work with everybody.
And so, Nelin, do you provide any type of virtual service for individuals?
Yeah, so the course that we have created, it is an online course. And so you can enroll anytime from anywhere in the world and access. We have many videos and trainings and guided visualizations and audio clips and downloadable documents in there that you can use as reference material. And then you can also go through the course through each module and learn it all kind of builds on each other. So that you can equip yourself with all of the tools that you need to start to sort of get to the root of whatever it is that's creating your pain problem. So that could be done anywhere. And then we also have like shorter 1 or 2 page documents, just little reference guides to just sort of improve the way that you're already doing things. Like if you're already doing, yoga or stretches or whatever daily, just those little ways to change them to incorporate myofascial principles so you can get more out of them every time you do them. So we have those. And then we also offer some virtual counseling services. So it's more of a coaching, because we obviously can't put our hands on you. But it is more of a coaching, but we do offer that as well to help people sort of like problem solve and get through sorting through all the different things that are going on and help them find a direction of where to start.
Thank you for that. Thank you so much. Nelin, is there anything you think that I missed that you'd like to share with the listening audience?
No, I think that you really covered it all. It was really lovely to hear your story. And I think that sharing that as well is really powerful and helps other people to be able to recognize something going on within themselves that maybe needs addressing. So that's just my goal, is just to help open people's minds and give them hope too, that there's another way that they can find some pain relief.
So how can the listening audience get connected to you or to your services, or just for more information?
Yeah, absolutely. So we are on social media. You can find us at Myofascial Canada or at Myofascial Mississauga, if you can spell that. And then our website is also myofascialmississauga.com. If you just type in myofascial release in Canada, you Google, you'll find us. But we have tons of videos on Instagram and TikTok and YouTube. So lots of great free information out there that we would love for you to access and learn from. Also, there's not too many Nelins in the world. So if you just type my name in Google, it'll probably come up as well.
And then I'll also tag this video, you guys, in the post so you guys can be able to connect to her platform as well.
Wonderful.
So again, Nelin, thank you so much for coming and a part of the podcast. I really appreciate you coming on and sharing your knowledge, your tools. You helped me learn something new because this is something that I experience in my personal life. I can also share this with my friends and family. So thank you so much for coming on. It really was beneficial.
Wonderful.
So you guys, thanks for tuning in to Bombshell 1111 Podcast. We hope that this episode sparks some inspiration and sets you on a path towards growth. Don't forget to subscribe and leave a review. It helps us bring you more content you love. And with that being said, always remember you are a bomb within your own shell. Peace, love, and light. Until next time, good night.